Hello, it's Dr. Rhonda Johnson. Today is Saturday, March 19th, 2022. And my question is, have you had your COVID vaccine booster shot? I know Americans are done with COVID, ready to move on, pretending it's gone, but COVID denial will not make this virus go away. Now, according to the CDC, as of March 16th, only about half of the booster eligible population has received a booster dose. And among Americans over the age of 65, about 15 million older Americans are vulnerable. Now, the CDC released a study yesterday showing that among adults hospitalized with COVID during the Delta and Omicron wave, those who had 2 or 3 doses of Pfizer or Moderna had a 90 to 95% less risk of dying or being put on a ventilator compared with adults who were unvaccinated. So why do we need a booster dose? Because vaccine-induced immunity to this virus wanes over time after about 4 months. But the good news is that a booster dose restores the protection, even with Omicron. So who is eligible for a booster? Basically, anybody who's 12 and up can get a Pfizer booster 5 months after the initial dose series is completed. For Moderna, you can get a booster 5 months after your primary series is completed if you're 18 and up, and Johnson & Johnson booster for 18 and up can be given 2 months after the initial shot. And you can mix and match boosters, and the CDC says if you got an initial Johnson & Johnson shot, they recommend you get boosted with either Pfizer or Moderna. Are there side effects from the booster shot? Well, yes, there can be. The most common ones are pain and swelling in the arm. Others include fever, fatigue, muscle aches, chills, headache, and nausea. Now, most of these side effects last for a day or two compared to long COVID, which can shrink your brain, damage your heart and lungs, and last for a lifetime. Now, some women get swelling of their lymph nodes and under the armpit, so wait a week or 2 after your booster to get a mammogram. Now, myocarditis is a rare but potentially very serious complication of the messenger RNA vaccines. For unknown reasons, male adolescents and young adults are more likely to have this, but it's rare, and fortunately, most patients recover. Now, if you've had long COVID, should you get a booster? The CDC says yes. When? The CDC says wait until you're no longer contagious and when you're feeling better. Now, I had COVID and I waited 3 months after my COVID infection to get my booster because I had monoclonal antibodies. So my take-home message is don't delay. Get that booster shot, especially if you're 65 and up or have any other underlying condition. Text your zip code to 438-829 or call 1-800-232-0233 to find out where you can get a COVID booster shot. That's my message today. As always, my views are my own. Take care, folks.